But despite all that is before us in that way, calling for our time and attention, there is nothing that demands our focus and our innovative energy and great creativity with greater urgency other than the public health crisis that we're going to talk about today, and it is the crisis of our broken mental health system. The prevalence of mental illness, substance use disorder, and intellectual disabilities in our society is undeniable. It affects our communities, large and small, all across the Commonwealth. For courts and our justice system, this prevalence has a disproportionate impact as our justice system has become the default system for addressing the needs of those with behavioral and mental health issues, and our prisons and our county jails, without question, are the largest providers, sadly, the largest providers of mental health services in the state. So we're here today to announce the establishment of the Kentucky Judicial Commission on Mental Health. The purpose is to develop, implement, and coordinate initiatives designed to improve the court's interaction with and the administration of justice for persons with mental illness, substance use disorders, and intellectual disabilities. We recognize that improving the lives of Kentuckians who are affected by mental illness or substance use disorders or intellectual disabilities and who are involved in the justice system demands complex, interdisciplinary, interbranch cooperation and solutions that we've never even thought of before. We're confident that many entities inside and outside state government share our desire for and commitment to improving the services for all Kentuckians. We're especially pleased to have the enthusiastic support of our Commonwealth's chief executive and the executive branch, and for leadership in the General Assembly. We're very pleased with their cooperation. And we look forward to working with them and others outside of state government, but cooperating across the board to make this happen. So I've asked my esteemed colleague, Justice Deborah Hembry Lambert, to lead this important commission, and I will recognize her now for remarks. Justice Lambert.
Commonwealth of Kentucky, and all assembled here today, my fellow Justice, Governor Beshear. I'm certainly honored to have been asked by the Chief Justice to lead this Judicial Mental Health Commission, and through his leadership, we hope to build a commission that will live beyond us for many a generation and help improve the daily lives of everyone for many, many years to come. And I also want to thank my fellow justices. 201, they have been very supportive of the innovative ideas that the Chief Justice and the members of his staff have come up with, and collectively, I must say collectively, we are nurses, prosecutors, district court, circuit court, appellate judges, drug court, truancy court judges, and many other roles have been played by us when we were out in our communities and before we were these justices that seem kind of boring and aloof perhaps. And though our view may seem somewhat distant now that we're in these Honduran paneled walls, we have not lost touch, and we see these cases and are touched by the needs of our fellow citizens and our community members. And we want to see a system that properly reacts and administers justice in a way that is efficient and timely. And this week, though it's been court week here in this building, I have had a bonus week of wonderful phone calls as I have contacted various members in our community to ask them to please help us as we come to the table to build this commission of various stakeholders. And along the way, I have also been able to learn of the many strengths of charitable organizations and work that is being done in our Commonwealth. We really are Kentucky strong, and I know that's been said many times with the Western Kentucky tornadoes and the Eastern Kentucky floods, but to hear of the work that's being done already in mental health in Kentucky, I can't wait to sit down for our first meeting on September 22nd and hear what's being done, remove the silos, and bring us all together in a more efficient way. So thank you to each of you who are here today who have agreed to serve. We have not yet announced the names of the folks who have agreed to serve. We will do that at a later date when that list is finalized. Already, as many of you here today know, I can't forget to thank the daily efforts of already there are police officers and nurses and doctors and social workers and judges who handle the daily crisis of mental health that goes on in our community every minute of the day. And those 202A cases, as we call them, when citizens are in true mental health crisis and are in dangerous situations, have to be addressed. And one of the things that we will handle with this commission is when we have our training summit in the spring, we will try to cross-train everyone so that each of us can understand what different roles each of us play and how we can improve each of our roles along the way and make things happen perhaps a little quicker, with greater quality, and with better outcomes. We already have many judges who volunteer and have for many years serving as drug court judges, and we have veterans courts and mental health courts in various areas of the state. We will ask them to share their expertise and help us build those communities or those programs in other communities. And our goal is to bring together law enforcement officers, doctors, nurses, hospitals, county attorneys, and physical courts, counselors in treatment facilities, legislators and cabinet secretaries, jailers associations, and probation and parole folks, religious organizations that are doing charitable work with those with mental illness, and any others who share our passion for mental health. This is an unprecedented effort for Kentucky and a very hopeful effort. Mental health needs hope, our country needs hope, and our citizens need hope. And I don't know a single place that is more filled with hope than Kentuckians can be. And I'm excited for this focus. While we are going to be focusing on mental health and substance use cases, I'm particularly excited that this will be the first time that there will be an all-hands-on-board effort to assess and improve the way the court handles intellectual disabilities. No group this broad and with this many resources has ever come together to tackle all three of those important issues, and I am just simply excited. And I think others on this commission are similarly excited. And with no further ado, and with no additional need to introduce our renowned governor, Governor Beshear. Thank you so much.
Yeah, I'm used to facing the other direction. But y'all are dressed differently today. Yes. I am honored and excited to be here today, joined by members of my administration, ranging from my chief of staff to our Secretary of the Justice Cabinet, to our head of Medicaid, to the fine troopers in the Kentucky State Police, to show our full support and commitment to this endeavor, both that the court is pursuing as well as all of those out there advocating and pushing for the type of mental health resources that our people need. The last 2.5 years have shown us anything. It's that suffering and trauma are real. Whether that's COVID-19 turning our world upside down, the grief of losing over 16,000 of our fellow Kentuckians, the health impacts that it has had, both physical but also mental. Whether it's multiple ice storms, the worst tornado disaster that we have ever seen in the West, or now the worst flooding we've ever seen in the East. All it takes is talking to one of these survivors or a family member of one not so lucky to see that the scars that it leaves on us aren't just physical, but also mental. We have come so far in recognizing that healthcare is a basic human right, but we still have a long way to go to make sure that mental health is treated as physical health, that the services are there, and that the stigma is gone. You know, it was just a couple weeks ago that we were at an event with one of our fine district court judges, and so many of our advocates out here, where an individual stood up and said something that stuck with me, and I've said it to so many people these last 2 weeks, that it's okay to not be okay. And recognizing that whether it is in a normal life that we might not think we have seen or gone through trauma, or whether it's folks that have been through the toughest, that could be of upbringing, of situations, that we face challenges to our mental health that our bodies and our brains are not designed to overcome on their own. And I think this program, this recognition by the Kentucky Supreme Court, bringing so many resources together, is going to go a long way, not just to move people through a justice system, but to get them better, to get outcomes that we all want, to not have a revolving door when maybe some additional services that now we know are there and that we can connect people to won't just get people out of a system, it'll get them healthy. It'll get them better. It may get them back with their families, back in steady employment, back in society in ways that so many, because I recognize so many of you all here, whether it's in our battle against addiction or in the field of mental health, have seen. You know, those miracles are possible. And it's truly a miracle to each family that has somebody come home and truly home in a way that many thought might not be possible. The Kentucky Judicial Commission on Mental Health is looking to make a proactive and innovative change to how mental health services are provided in this setting. We know that too often the court system can become sort of that revolving door for people who need other sorts of help. An undiagnosed or ineffectively treated mental health or addiction issue exacerbates or sometimes is the chief driver in what ultimately ends up with folks coming into the judicial system. Left unaddressed, we shouldn't be surprised to see the same people or to see additional harm ultimately coming out of it. My faith tells me that second chances are possible and that providing them are our job. Providing them in proactive ways that are going to keep our people safe across the Commonwealth, but ultimately help folks who are maybe in the lowest and darkest point of their lives find the light and be connected with the professionals that go through so much training to be there for them at that moment. So I want to thank Chief Justice John Minton Jr. for launching the commission, as well as Justice Lambert for taking the reins as lead commissioner. Let's give them the big round of applause they never get in this chamber. And I want them to know, like I know that you know, that this is an all-hands-on-deck approach. No D, no R, no red, no blue, no left, no right, just moving forward for people that need our help and coming together to do something that ultimately we can not only be a leader in, but we can lead with our faith and our values by helping people in their time of need. We've worked to prioritize how mental health is handled in law enforcement. Our Department of Corrections works to offer comprehensive mental health services to its population. The Department of Juvenile Justice has a community and mental health branch that works on better outcomes. Our law enforcement officers currently receive training on how to recognize and interact with folks in a mental health crisis, but our leaders are always looking on ways to improve. That's why I'm so proud of the Kentucky State Police and State Police Commissioner Philip Burnett, who, my understanding, will likely have a major role on this commission. It is important work, and it's part of our efforts to foster good mental health care at every level. And it's also about talking to people about their mental health care needs, oftentimes our young people. I'm proud that Lieutenant Governor Coleman has launched the Student Mental Health Initiative, where more than anything else we are listening to the challenges that our young people are going through today that are so different than so many of us went through, regardless of how young we like to think we are, until maybe we look in the mirror. Next week, she and the students are going to be meeting with the Interim Joint Committee on Education. Very proud that committee is going to listen and hear from those students. It's about the legislature stepping up and doing innovative things like passing House Bill 44, permitting Kentucky schools to allow students to have that mental health day just like they can take physical health days. It's the youth mental health first aid training that's going on for adults to help recognize those in need. It's Senate Bill 178 extending Medicaid benefits to children and women who are pregnant or postpartum specifically for those mental health needs that people can face. And it's Tim's Law, which expanded access to assist outpatient treatment for folks with severe mental illness. For far too long, people have believed that seeking mental health assistance is a weakness. It's not. And today, the Kentucky Supreme Court has joined with so many others, I think, to say it's okay not to be okay. It's okay to ask for help. And you know, for those that haven't asked for help, it's okay for this court and others to get you help when you are in need. Whether it's the new 988 number for mental health crisis, to where we now have something similar to 911 for mental health, or whether it's the recognition of these leaders behind us. Today is a really good day, and this is a really big deal. The Kentucky Judicial Commission on Mental Health, I think, is going to be a legacy of this court, of going above and beyond the job that we're sworn in to do, to being our brother and sister's keeper, to remembering that treating our neighbor as ourselves is one of the highest callings and one of the most important commandments in that parable of the Good Samaritan, that everybody is our neighbor, including the lost and the lonely and the left behind. This is a good day for Kentucky. It's a good day for those in need, and it is a great example of a really incredible Supreme Court taking on an initiative to help our people in need. Thank you all very much.